Okay, great, thank you. I'd like to recognize Chancellor Golly, who will call on two of his students to do the prayer and the pledge, and then we will hold Dr. Owings till later in the agenda, if you don't mind.
Yes, sir. Mr. Chairman, we have three stellar representatives today from the LSU Health Science Center in Shreveport, two students from the School of Medicine, and one faculty member. At this time, I'd like Gina to come up, Eugenia White, to come up and give the invocation. Just, I'd like to say that she's a rising, grew up in Baton Rouge, graduating from Episcopal High School before attending Wellesley College and receiving a degree in chemistry with honors. Gina's background prior to medical school involved biotechnology industry research, which kindled her intense interest in, obviously, research and technology development. She's involved with Chris Kevel on our campus, enrolling patients for type 1 diabetes trial. She was recently awarded a $30,000 fellowship with the Sarnoff Cardiovascular Research Foundation, which is a very wonderful achievement, recognizing her potential as a rising physician scientist. And she's trying to select right now between Brigham and Women's in Boston, or New York City at Columbia University, or at Stanford in San Francisco, to see where she's going to do that 1 year between now and the time she comes back to complete her 4th year of medical school. Gina.
Thanks, Dr. Golly. Good afternoon. My name is Eugenia White. I'm a 4th year medical student representing Louisiana State University Health Science Center Shreveport campus. I'm pleased to be here and to welcome everyone. I grew up in Baton Rouge, and this is an honor. Thank you, Chancellor Golly and President Alexander. We're all here because we care about Louisiana and the community of academia represented here. This meeting is an opportunity for each of us to impact our community and be a part of changes that will become the future of the state. This is a safe and open place full of courageous and strong leaders seeking the best outcomes for our community. And this meeting is an opportunity to show respect and humility for ourselves and our colleagues as we help each other prevail. So on behalf of LSU HSC Shreveport, I thank you all for being here, and I'll open the meeting with a prayer, if you'll bow your head with me. Lord, we ask that you will give courage and wisdom to those invested with decision-making authority in these important proceedings. We humbly ask for your watch care of this meeting to the service of our shared academic communities. Amen.
Thank you, Gina. Next, for our Pledge of Allegiance, we have Tripp, Eugene, there you are. Sicardo, he's a native of Alexandria and actually was a scholarship recipient through our current chair, Mr. Ray Lassane. He's a 3rd year medical student at LSU. I'm going to say a little bit more about him right after the pledge. Go ahead.
Please everyone remain standing. Place your right hand over your heart as we recite the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I just want to say about Tripp, like I said, he's a native of Alexandria. He graduated from LSU in 2013 with a Bachelor's of Science degree in Biological Sciences. Then he worked at the Pennington Biomedical Research Center, the Princeton Review, and for the Louisiana State Police before applying to LSU Health Science Center in Shreveport. He decided to become a doctor after working at Camp Sweeney, a camp for children with type 1 diabetes. And his desire is to comfort and provide personal and medical care for these children and others like them who suffer from incurable illnesses. And that's driven him to pursue a career in medicine. Did you want to say a few words, Tripp?
Yes, I'd like to just first off, I haven't had anything prepared, but I want to say thank y'all for allowing us to come here and represent LSU Health Shreveport as the representatives. And secondly, on a more personal note, I'd like to thank y'all for the scholarship. It's a huge financial aid to myself, and I don't know if I'd be in the same position as I am today without it. And lastly, I think I stand behind all my fellow students at LSU HSC and say that we fully support all of your decisions and hard work and time y'all put in, and that it does not go unnoticed. And we are fully supporting of everything y'all do and decide, as well as we know how much y'all support us. And we want to just thank you for that, and I appreciate everything y'all do. Thank y'all for having us.
Thank you.
Thank you. Thank you, Tripp and Eugenia. We appreciate you being here with us today, and wish you all the best in your future studies.
Gina, you need to come back because New York, Boston, and San Francisco are 3 of the 4 most expensive places in the country to live.
Okay, as we're rearranging things, we're going to move to the approval of the minutes, and then we'll come back after a couple of other items to Dr. Onings. So you have the minutes before you.
Motion to approve.
Motion to approve. Second by Mr. Moore. All in favor?
Aye.
All opposed? Motion carries. We will go to reports to the board. In your package, you have 2 reports, fiscal year 2015-16, third quarter internal audit summary report, and the LIFT award report. Can I get a motion to approve these if there's no question?
So moved.
Moved by Mr. Moore, second by
Second.
Mr. McCreary. All in favor?
Aye.
All opposed? Motion carries. Next, we go to the committee reports. All of the committee action items were approved unanimously, so that allows us to accept the motion to accept all of the committee reports and actions.
I so move.
Motion by Mr. McCreary, second by Mr. Chatelain. Any discussions? All in favor? Aye. All opposed? Motion carries. Okay, now let's see. We're going to double back. Pardon?
I think 5 personnel action.
Personnel actions, okay, we have the, I'm trying to find it, okay.
Right here.
Okay, personnel actions, you have a report in your file that was sent to you. Any questions about the personnel actions? I have a motion to accept. Oh, Tom?
Staff's reviewed the actions and recommends approval.
Okay, thank you. Okay, sorry we got things out of order. We were trying to get these votes in before everybody left. Yeah, okay. Let's go to,
We need to vote on the personnel.
Vote on the
Personnel action.
Personnel, okay.
We need to vote on, who recommended it.
any questions? Tom recommended it.
Moved, second.
Moved by Rolfe, second by James. All in favor?
Aye.
Okay, thank you. Now we can go back to Dr. Golly and Dr. Onings.
Sure.
Sorry for the,
Mr. Chairman, thank you for this opportunity. Our third representative from the Health Science Center in Shreveport is Dr. John Onings, our chairman or chief of the trauma service. Yesterday, as an example, yesterday in Ouachita Parish, as Mr. Moore knows, there was quite a tragedy. 2 sheriff deputies were shot serving a warrant for the U.S. Marshals. One of those patients was airlifted from Monroe to our University Hospital in Shreveport, where Dr. Owings' trauma team took care of this gentleman. This is one example of the importance of a level 1 trauma center in the state of Louisiana, in New Orleans and in Shreveport. So this just sort of exemplifies the importance. Dr. Owings is we won't hold it against him, but a graduate of Tulane Medical School, and did his residency at UC Davis, served on faculty at UC Davis, first as an instructor, moving up the ranks to a full professor, then to Associate Dean of Student Affairs and Career Counseling. He has been with us since 2013 at the LSU Health Science Center in Shreveport, and has indeed been instrumental in us regaining our level 1 trauma status. Currently, Dr. Owings serves as the vice chairman of the board for the Louisiana Emergency Response Network, or LEARN, and is really actively involved in the management and teaching of trauma to students and residents in our Health Science Center. John.
Thank you, Dr. Ghali, and thank you all for what you do. There should be some slides coming up, and I will make them brief and ideally data-driven. The leading cause of death in the United States from trauma in 2014 actually was simply fall. The gunshot wounds get a lot of notoriety, but common things happen commonly. In 2015, it was surpassed by automobile crashes, but they go back and forth. When I arrived in Shreveport in 2013, there was no state-designated trauma center. Patients were triaged based on what were anatomic and physiologic criteria. That meant they were dead, dying, shot, stabbed, or indigent. And if they had any of those criteria, they would be brought to LSU. Otherwise, they would be taken to one of the private hospitals. Excuse me. The transfer to a private hospital instead of a trauma center might result in a patient arriving where there's no surgeon available, no operating room open. And that led to the need to call 911 for a patient who might need those services and bring them to the LSU hospital where the services were available. Obviously, that's cost ineffective, and it had an adverse outcome on death. The next set of statistics were the 2013 EMS run statistics for trauma patients in the city of Shreveport. And what you see is only about 1/3 of the patients that suffered trauma were actually brought to what was then the Acting Trauma Center at LSU. And more than half were brought to major private institutions that had no commitment to trauma and frequently did not have the availability of the necessary rooms or personnel. In 2016, where we stand is we regained our accreditation as a Level 1 trauma center. We did that in July of 2014. We've changed the way we look at trauma and how we triage it. This was something that took a fair amount of negotiation, but we've moved from the anatomic and physiologic and financial triage to using CDC trauma triage criteria. And we've done that not only in the region up at Shreveport, but also in the state. And from that, we had to have buy-in from EMS, from the regional hospitals, which they have bought in, and from the people themselves. These data are a combination of, this particular slide is from a study done by Ellen McKenzie, and it's published in the New England Journal of Medicine, and it's somewhat intuitive. Severely injured patients wind up having a lower mortality rate if they're taken to trauma centers. And that's true not only in the short term, that is, live to discharge, but also if you look out for a period of years, that mortality difference is sustained. What about here in Louisiana? What difference does it make? We've got some really great hospitals here. Do you really need to have the expenditure of a trauma center? These data are from the LEARN, Louisiana Emergency Response Network, and from calls that came in to the Louisiana Emergency Response Network. And I worked on this study with John Hunt from New Orleans as the other senior investigator. And what we had was about 15,000 calls that came in. We stratified those, and what we wanted to see was seeing calls coming in, asking for direction, where do I go? Whether going to a trauma center made a difference. And what we found was we had 14,000 patients that qualified, 13,000 followed the LEARN recommendation, which was to follow the CDC trauma triage criteria. About 1,000 patients didn't follow those recommendations. The areas where we had the highest rates of noncompliance were Shreveport, Monroe, and then in the midsection of the state. The secondary transfer rates for the patients who followed the LEARN criteria was only 4%. For the patients that did not follow the secondary transfer rate or need to go to another hospital was 30%. Thank you. More importantly, the mortality for the patients who followed the CDC trauma triage criteria was 0.6%. And for those who chose to go to their hospital, it was 2%. And that was statistically significant by a large margin. So in summary, trauma centers save lives. LSU Health Sciences Center and your investment has saved lives, has saved the people of Louisiana. By decreasing secondary transfers, you're saving money, but more importantly, you're saving lives. And in the process, we're able to do research like this, we're able to educate, and we're able to train the next generation of physicians to live in Shreveport and practice in Shreveport and save lives there. Thank you.
Thank you, Dr. Owens. I know several of your trauma patients that survived because of the wonderful medical care y'all provided, so thank you very much. Question?
Yes, sir.
Very quickly, for those of us who are not completely aware, emergency room medicine is a specialty in and of itself, correct?
Correct.
The trauma subset of emergency room medicine, how does that work in terms of training? Are they divergent paths? Is that a specialty inside of ER? Is that, because for example, there's certain types of trauma that require certain types of specialty, like gunshot, for example, and there's some that are more skilled than others. So how does that work in the field of medicine, and how does it work with you on the trauma side of the ER picture?
That's a great question, and it really goes back to my first slide. So trauma surgery is a surgical specialty, so you do general surgery as your residency, and then you specialize in trauma surgery. Emergency medicine, so that's a 6-year path. Emergency medicine is a 3-year path. And so what you would think is a simple fall is something that is not going to require very much in the way of sophisticated care. Unfortunately, that's not true. Many people are on Plavix, or they're on some other drug-eluting or platelet-eluting drug to keep their stents open. And a simple fall from standing can be a fatal event. And so it really requires a complete symphony of players to be able to respond to those patients and treat them in a timely manner to have the ideal outcome.
So how many emergency rooms in our hospitals have trauma surgeons on duty at those hospitals?
In Louisiana, we have 4 trauma centers. There's the Level 1 Trauma Center that Dr. Ollier has, the Level 1 that Dr. Ghali has, Our Lady of the Lake is a Level 2, and then Rapides in Alexandria is a Level 2. I've been working diligently.
What distinguishes 2 and 1?
The difference between a Level 2 and a Level 1 is actually, on the clinical side, fairly small. It's cardiopulmonary bypass capability 24/7. Otherwise, it's research, education, outreach, and things along those lines. But practically, for you as a citizen, there's really not a big difference.
Thank you.
Question.
Yes, sir.
Was University Health helpful in regaining your status as a Level 1 trauma center?
Absolutely. The University Health has been not only a partner, they've been a champion. And in terms of, one of the things that I said is that by having LSU Health Shreveport training physicians, you have physicians staying in the region. And consequently, if you take the reverse of that, if it goes away, the physicians go away. I've had a very difficult time attracting new trauma surgeons to Shreveport, and UH has helped me financially and with personnel.
How are they as a manager of the hospital?
I'm sorry?
How is University Health as a manager of the hospital?
I'm not really an expert in hospital management, but in terms of the day-to-day operational activities, it's a seamless, it runs quite well.
Thank you.
Okay, thank you, Dr. Owings, and thank you.
Thank you.
Ms. Whites and Mr. Sicardo. Appreciate all of you being here, and I'm very happy to have the Trauma Center in Shreveport, so thank you very much for reestablishing that. And I also want to report that Dr.
The chancellor was also involved with that.
Yes, he was heavily, and I also want to report that while he was in the legislature last week or week before last lobbying on behalf of LSU, he had the opportunity to apply his medical skills and hopefully saved a legislator that was having a heart attack.
And knowing from this morning, at 6 o'clock this morning, he was there with a police officer assuring me he was going to be okay. I mean, that's something really phenomenal about our two chancellors to my right, that they are at the front line, and being head of medical schools and all, that's got to be something that differentiates our medical schools from most medical schools in the country. But it's phenomenal what this guy and what they did. The pictures he has right here on his phone, you could not believe, of that police officer and what happened there.
Great, I was not aware of that.
Yesterday.
Yesterday?
That happened yesterday.
Okay.
Shot through the neck, a police officer.
What is the supply and demand ratio right now in the world in terms of trauma surgeons? Do we have an adequate number being trained?
No.
Do we have a greater need for them?
There's 3 jobs for every trauma surgeon. And so our plan is to have a trauma fellowship within the next 3 years. They have a trauma fellowship down in New Orleans.
Any other questions for Dr. Owings?
Amazing story.
Okay, thank you.
It is.
Thank you so much.
Okay, next we will make our 2 new board members official by swearing them in. If you will both join Mr. Stanley Jacobs down in front for the oath of office, Mr. James Williams and Zach Faircloth will become official board members.
Have Blake do it. Have Blake do it. No. Oh,
Okay, Stanley, will you stay up here, please? We also have a reappointment of Stephen Perry, and if you will, swear him in also, just to make it official. Thank you, Stanley, and congratulations to Mr. Williams, Mr. Faircloth, and Mr. Perry. Glad to have you all with us. Okay, now we will get to the reports from the Council of Faculty Advisors. Dr. James Robinson will report to us in the absence of Dr. Cope. Welcome.
Dr. Cope has the flu, so as Vice Chair of the LSU Faculty Advisory Committee, I'll get the report. First of all, we have an Association of Louisiana Faculty Senate's meeting at LSU Alexandria this coming up Saturday the 9th at 10 o'clock. You all are certainly invited to come. We would certainly welcome you. Secondly, ongoing issue, the need for faculty raises. We're losing faculty. In fact, our department head, personally affects me, is leaving as of today. Got a better offer. And that's a shame. This has been the best one we've ever had since the inception of LSU Eunice. And it's the good ones that leave, and that's a problem. Thirdly, we certainly appreciate the advances in online education that are being made. This is a major force in education, and it's only going to grow exponentially over time. I've been teaching online courses for quite a few years now, and it is really, really good for the students. And faculty certainly do appreciate it when they get any help here. And personally, I'd like to express my sincere appreciation for the support and vision of President Alexander and Chancellor Russell's advancing LSU Eunice into the future with their innovative and creative ideas that have been put in place there. Thank you.
Thank you, Dr. Robinson. Okay, next on the agenda is...
Staff advisors. Are the staff advisors?
No, they're not here.
Not count, okay.
I mean, they're not giving a report today.
Okay. Just wanted to,
This whole agenda has been changed.
Okay.
So
I just
it's
want-
been moved out of order. It does seem very disjointed, and it is. So,
I
but
just
it's- but
make
it's-
sure we recognize our staff advisors.
But
and
it's by late
Great
design.
staff.
Yeah, I agree. Okay, next is the president's report.
Okay, thank you, Mr. Chair. I'd first again would like to thank Dr. Joyner for stepping in the interim position. He is, as I've been fortunate to work with him in various capacities for 3 years, and we look forward to working with you as we go forward together to build LSUA and LSU collectively. I also like to point out that today we are announcing 3 letters of intent that Mr. Yick and our financial advisor to our interim Chancellor Ghali at LSU Shreveport Medical Center, 4 letters of intent to help build the capacity of our medical school and to provide better, it's far expanding the opportunities for our residents and our students, much like the multiple opportunities that exist in New Orleans. And those 4 letters of intent have been signed with Christus, Rapides, Willis Knighton, and FMOL in Monroe, which they are willing and eager to work with us to build the capacity of our medical school and to provide even additional opportunities that we can have to serve the entire north region of the state. Very pleased. It says recap on legislative session. I think we've gone through that. I'd once again thank everybody for their hard work and patience and diligence to get us through a very trying and difficult time that seemed to encompass just about far more than most of us wanted it to, but it sure did. And I thank our legislative leadership, our legislators, and certainly our governor for protecting our universities first. And for the first time in about 8 years, we've been able to say that you have to have a place to go. TOPS is vitally important to our students, but if a TOPS to nowhere doesn't get you much. And a TOPS to top quality educational opportunities with courses you need and courses you can get where you can graduate in a timely manner is absolutely essential. Before I call upon Chancellor Russell to share with you this, I'd like to share this, and she can comment on it. LSUE was selected by the U.S. Department of Education as an inaugural participant in dual enrollment experimental program. And that's because of the success of our institution and the success that they've had there. It's only one of 44 institutions nationwide. And Chancellor Russell, if you'd like to comment, certainly, on this great accomplishment.
We are very excited about it. They're allocating right now about $20 million across the country and 44 institutions to try this experiment. It's very important for us because we serve a very low socioeconomic level of student. Students coming out of St. Landry Parish, we are forming a partnership with them to offer a sort of an early college in healthcare. It will be housed on our campus, and a portion of it will be housed at Opelousas High School. We're going to be serving students that less than 50% attend post-secondary education of any sort, whether that's starting at a community college or at a four-year institution. So we're very excited about it. I think the parish is excited about it. They have some of the poorest performing schools from the state of Louisiana. So we're hoping to really make a difference in that region. And it'll also open up some doors for us as well with our current partner institutions where we serve high schools. We serve about 19 different high schools across the state in dual credit, and it will allow them to participate in this program as well.
So what's really unique about this program is Pell Grants don't go to high school students, but this is a program for these 44 institutions where Pell Grants will start to go to high school students that are enrolled in dual credit programs. So that's the uniqueness of this Department of Education grant, and we're one of 44 nationwide selected to participate in it. Rolf?
So they, from their campuses, are taking courses, are they online, or you're
Most of those are face-to-face, whether it's in the high school using a credentialed faculty member from either our institution or one that's employed there at that high school, both ways.
so you send faculty, or they come to campus?
Correct.
See, and do they start all seniors, or they junior, senior?
Actually, they start mostly juniors and seniors, but we do have some sophomores now.
And potentially, what's the number of hours or credits they could actually graduate with one of their top students? How many hours?
Well, that's really up to the high school. It's really unlimited, depending on what the high school offers as a dual credit. In the partnership that we have, students could actually obtain a degree from us, whether that's an associate degree or some sort of certificate, when they graduate from high school.
I know you all have done that in the past with University High here, I think.
That's correct. In fact, we're launching that this fall.
Doing that with them as well?
Correct.
And the student pays that fee, or does the school pay that fee with you?
It depends on the district. Some high schools, they do provide some funding. The way funding for K through 12s is significantly declining in the state. We were hoping that this program, students will be able to step in and be able to pay those fees. As long as those courses apply toward a degree or certificate, then they are eligible from our institution to access Pell.
I applaud the innovation, and as Dr. Alexander said, these students come out, they're on track then to potentially finish 4 or even 3 and save money and cut their costs down, their debt and everything else, so it's a win-win all around.
Yes.
And the beauty of this is now they can get a Pell Grant, which was off limits because they didn't start. And that's really the uniqueness of this opportunity in this project, is that there's very few institutions around the country, and this is the only one in Louisiana that has that opportunity. So, thank you, Chancellor Russell. Last meeting, we celebrated the LIGO discovery, the gravitational wave, and I remember discussing it with our professors and our faculty, and they said, now we need to verify this by finding having a second discovery of a gravitational wave. Said the difference is now they know what to look for, and they've already discovered that. They've discovered a second gravitational wave that came from virtually a similar black hole double explosion. That's about as scientific as my explanation gets. But this is great verification of the work that we're doing that has significant international ramifications of a significant magnitude. The Cancer Moonshot meeting that I'd like to ask Chancellor Oye if he could comment on this. This is Vice President Biden's initiative to eradicate cancer, and we've been selected, or we're having a National Moonshot Summit on June 29th. And if you'd like to comment, Chancellor Oye.
Well, I think we've been very fortunate. One of our senior investigators, Augusto Ochoa, has been chosen as one of the few leaders across the country in this. And they are setting up, symposia and large congresses in various areas to demonstrate the various opportunities of research that are being done, in particular looking at the cancer center that we have here, and I think one in Shreveport as well is going to be done there. So this is a real major opportunity for expansion of our research efforts.
Thank you, Chancellor Oye. That is June 29th at our Cancer Research Center, where that event will be going on. Something unique our students came to us with a little while ago was the idea that we need to get more students to vote. And that's a national issue, but even more importantly, it's an issue that we need to rectify. And I'd like to ask Zach Faircloth, our new board member, to talk about the efforts that we made in conjunction with a legislative bill, House Bill 940, that passed even though we were in front of it. But it's our effort to have the largest student voter turnout this coming November in our history, and this is going to help us significantly. Zach?
Yeah, absolutely. So HB 940 is just a small component of the idea that we want more students to vote, especially here at LSU. We've made the effort 2 years ago. It actually started as a student Senate bill to expand voter turnout for students by making voter ID cards out of our already student IDs that we get issued. So we went ahead with that. Turns out it ended up in the state legislature and passed this year. So now all the systems, with the exception of LCTCS, I believe, are going to be required to have their student ID cards be voter IDs as well. It's really simple for us. All we're going to have to do is apply a line where a student can put a signature, and they'll be able to go to any voting location and vote with their student ID card now. But like Dr. Alexander said, it's just a small piece of the greater idea of how can we expand student voting. We're looking into ways to bring Senate Mayor's Forum. We're going to be talking about a lot of congressional races. So we're going to be working with our students here on the LSU main campus and expanding that to other LSU campuses to get more voters.
This is a great initiative because our students couldn't vote here, except the ones that lived here. So they're here while elections are going on, especially in November, early November, and if they use their driver's license, they tell them to go home and vote. Now this signature on the card for our students means that that can be used as a voter ID, and therefore, and we're working also to get a voter precinct here in our student union. So we want our students voting. Not everybody always does, but we certainly do. And I'll also point out that Zach Faircloth, Mr. Faircloth, last year put together our first student report card of legislative voting. And just like the NRA does, and our hospitals do, healthcare does, lobby does, Zach put together the first one, and it's quite simple. Those that say they support higher education, the scorecard measure, the report card measures you how you actually voted on higher education to support our students. And he caught a little bit of flack on that because they were calling my office too, thinking I was behind it all. But it was student government who was doing it for the right reasons.
He wasn't. Which you were, of course, right?
Of course not. But they put together a student report card, and Zach started getting a bunch of phone calls from those that didn't like their grades. And I said, all that means is you've done more to make students more relevant than you've ever become before. So the new report card will be coming out Wednesday? Monday. So right on the heels. So my phone will be ringing probably Tuesday. Yours will be ringing right around Monday or Tuesday. And well, it's about your votes. It's about your votes at the end of the day.
You know, that idea about getting a precinct set up so that is a great idea. I mean, that's something, you're talking about access there. I mean, that's a true access issue that seems like, and especially if we could get students to man, you know, as, I forgot what it's called, those who.
Voter precinct commissioners.
Yeah, as commissioners. I mean, what a great thing that would be.
It's also bringing to life so many important lifelong opportunities that our student union can play. And getting our students into habits of voting right when they turn 18 is one of the best things we could do. At the same time, our numbers are bursting at the seams in terms of how many students are getting their passport at our student union, because we set up a passport shop there too as well. And students are just getting their passports for international travel, summer travel, and so the combination of these things are lifelong issues for our students that I think this perhaps, normally what's the number of students we have voting in a November election, Zach?
Not near enough.
Yeah, it's barely 1,000 at that, because when the students came to me, they said, our goal is 1,000. I said, 1,000? I said, let's make it 10,000, and let's make it easy for all of our students. Let's make it easy. Thank you, Zach. The TAT report that is included in your report, the Transition Advisory Team that many may have forgotten about, it's in the purple folder. It's a purple sheet. It shows that we've made significant progress on recruitment, student success, national award winners since 13, 5 Goldwaters, 2 Fulbrights, 5 Trumans, 1 Cambridge, 1 Udall, 25 NSF graduate fellowships, 2 Olmsteds, and 1 Scoville Peace Fellowship. Our students are pulling in awards with some of the best universities in the country, and at the same time, our recruitment efforts and to keep them here are growing as our student retention efforts. One other important part that we thought was going to be very, very difficult for us is in the management information system. On July 1st, our new system, we turn it on. So it's the first phase of eliminating our old COBOL system, and it's our financial management system, and Workday will go into effect, and we've had a team of people. As Brian, I saw Brian out there earlier, Brian Nichols, but there's a team of people on all of our campuses that have been working together to implement a new contemporary model of financial management information system, getting rid of the 1959 system that we've had in place that is held together by duct tape. And the next stage is moving into our student system that is part of Workday, of which we are a pilot, which we can help design how that pilot works on behalf of our students, student financial aid, course management, and all the other areas. So in an area that we thought we had no idea how we were going to get to the $30 million price tag that was out there, we substantially found a new and innovative Workday package that's being used from Miami-Dade Community College, which is the largest community college in America, all the way to Texas Austin, and it's picking up steam. Berkeley, institutions all over the country have adopted it. We were lucky to get in on the front end of it. So we're in the process of flipping the switch on July 1, and this is a major significant development for us and progression for us. So it keeps us from being worried that our financial management system goes down and or our ability to pay our employees goes down, or admissions and applications process, which has gone down for 2 and 3 days at a time. So I just wanted everybody to know that we are still paying attention to the Transition Advisory Team recommendations. We have made progress in virtually every area, and right to the report today on the World Campus, Rolf, right down to the World Campus on online education. Just a couple other things. The LIFT Fund, to date, we've had 58 awards in the LIFT Fund, $2 million worth of totaling $2 million in supporting faculty initiatives. It's been very well received by our faculty, and we continue to move forward, and we're developing patents. And for many of you, when I get a patent notification, I send it out to you just to remind you of some of those are LIFT and some of those are just ongoing. And I think we have over easily 500, 600 patents currently to this day.
Last one was Japan, right?
It was Japan. Exactly. It was patented in Japan. The GRADAC scores, I'm pleased to say, for all of our institutions are 100%. So every one of our institutions met their GRADAC scores, and this is the last year of the GRADAC, but it's always great to go out in a blaze of glory, and we don't know what's going to happen to the GRADAC as we go forward. And finally, I'd like to recognize Chancellor Dan Howard. Dan is leaving us because of a family health issue that he's going to be addressing. And those things are the most important issues that any of us have to address. But Dan, it is a family member. He's going to help. And I can tell you in the last 2 years, Dan, you have done an outstanding job turning LSUA around, getting a high school on campus, dual enrollments on campus, having the largest enrollment increase in the state last year, almost 22%, with enrollment going up again. And I'd like to thank you, and I know Ray has something to read on your behalf.
I do. We have a resolution recognizing your service as Chancellor of LSU Alexandria. Whereas Dr. G. Daniel Howard has served as the Chancellor of LSU Alexandria since 2014. Dr. Howard earned a bachelor's degree from Manhattan College and 2 master's degrees from Indiana University. whereas under the leadership of Dr. Howard, LSUA has experienced significant growth and achieved numerous milestones, including the highest number of students enrolled in baccalaureate programs, largest number of transfer students, highest number of out-of-state students, largest number of international students, highest number of students of color, largest number of students living in residence halls, highest freshman high school grade point average, and largest number of students enrolled in the honors program. And whereas Dr. Howard successfully implemented improvements to the institution's enrollment management program, facilitated the establishment of the ROTC program, created 5 new NAIA sports teams, and began implementation of high school academy, grades 9 through 12, on the LSUA campus, and an academic honors program. Whereas LSUA has seen its institutional reserve funds grow from approximately $122,000 to more than $2 million, and the establishment of the first health center in the history of the university during Dr. Howard's chancellorship. Whereas, due to his significant contributions to the advancement of LSUA, Dr. Howard has been named Chancellor Emeritus. Now, therefore, be it resolved that the Board of Supervisors for the Louisiana State University and Agricultural and Mechanical College hereby recognizes and commends Dr. Daniel Howard for his loyal dedication and leadership of LSU Alexandria and wishes him a well-deserved retirement.
Well, ladies and gentlemen, truly it was an honor and privilege to be recognized, but I would be remiss in not indicating that all of those successes engaged our faculty, our students, our administrators, and our other supporters. Among those, Mr. Chatelain with the LSUA Foundation. He's a crossover member between the two. That foundation has provided us with scholarship support, endowed professorships, endowed eminent scholar chairs, underwriting for the honors program, and many other sources of funds without which we would not have been successful. So I just want to say that. And finally, I want to recognize Dr. Alexander. Without question, over the entire 44 years of my career, he simply has been the best administrator whom I've worked with, and I've worked with some very good supervisors. So, Dr. Alexander, thank you so very much for allowing me to serve, and thank you for allowing me to leave.
Thank you. Chancellor Howard was the right man at the right time that we needed, and we appreciate. And something I have to tease Blake about, how in the world did you get rugby to Alexandria?
You can understand rodeo a little better. Is that what you're saying?
Rodeo, too. I understand rodeo. It's a rugby.
Look, in rugby, we beat Alabama.
That's priceless. Congratulations, Chancellor Howard. Mr. Chair, that concludes my report.
Thank you, Mr. President, and that leads to the chairman's report, which is short. I ask you all to look into the purple folder on your desk. There is a list of the reports and the schedule that they will be furnished as a result of delegating some of our board responsibility to the president and the administration and the change of the bylaws. So that is in your report, so you can be, or in your purple folder, so we'll be expecting those reports. Is there any other business? Well, with that, I will accept adjournment, a motion for adjournment.
Move we adjourn.
Okay, moved and second. All in favor? Thank you. I appreciate everybody, and thanks for putting up with the disjointed meeting.
Sent out to